Hi, everyone. Thank you for joining us for Think Bigger, Do Good's ninth webinar in our series. We are going to just get started with a few logistics, and then I'm going to hand it over to Joe Pyle, our moderator for today. Our webinar is being recorded, and we will share it, the recording following the webinar. Also, with the email we share, we will send a copy of the paper that's going to be discussed, as well as any other materials that are brought up or resources that are mentioned. So we'll aggregate all of that and send that back out. We are in webinar format of Zoom, so please send your questions through the Q&A function so that we can respond both either live time verbally or even can write a response. We also share all of that information as well. So if some wonderful wisdom comes out of the Q&A, we can make sure that everyone can learn from that and take advantage of it. We just want to say quickly acknowledge our funding partners for Think Bigger, Do Good. Many of them are participating and listening in, and we continue to be grateful for their support of this work, the webinars, the papers, and all of the thought leadership that goes into that. I also want to thank our dissemination partner, Psychiatric Services. Many of the papers that Think Bigger, Do Good authors create are also placed in the journal and helped to be disseminated and promoted through the journal. So I want to acknowledge that. And now with that, it is 12:04. So I'm going to hand it over to Joe Pyle, who he is the moderator. And then we'll hear from the authors and get started.
Good afternoon, everyone. Maybe it's still morning in certain places that people are listening in from. I'm really excited to be with both Alex and Ruth today. Ruth is one of my favorite people, both in terms of how smart she is and how thoughtful, and also just enjoy her personality and presence. And Alex, who I'm newer to knowing, really enjoyed when we had our prep call last week. I only hope this webinar goes as well as our prep call did, because we had not only a good time, but felt like I came away learning a lot about this work. So everybody can find out more about Alex and Ruth on their bios, but we thought we would start with the three of us sharing something that might not be on our bio. Maybe Alex, do you want to start first?
Hi everyone, Alex Venet here up in Vermont where it just started snowing. And something that is not in my bio is that one of my non-education side gigs is sometimes I take tickets at the box office for a local theater company. I cannot act, so I'm not going to be on the stage, but I like to be around the whole theater magic situation. So you can find me there sometimes.
Ruth, do you want to share?
Yes. Good morning. It's morning for me, for everybody. I'm coming to you all from Sacramento, California. And I so appreciate, Joe, your introduction and happy to be on this webinar with you and Alex. And my thing that's not in my bio that I wanted to share is that I love travel, and my plan around travel is always where is the best food and wine. And so decisions about where I go are usually prioritized in that order. I just got back from a quick jaunt to the coast in California at Carmel by the sea, where I had a lot of good food and good wine.
That's great. And something that's not on my resume is that during COVID, I started taking guitar lessons. And we had a little bit of joking about, the formation of a band in my future. It's not in my near future, I'll put it that way. So with that, let's jump in here.
We're
And
looking forward to the band, though. We'll let everybody know when we start going on tour.
okay, sounds good. I wanted to start off with Ruth, and in terms of the context of this conversation, talk a little bit about the youth mental health crisis. And if you could kind of start us off, grounding us on the data and the trajectory of that trend, which is really not positive, and maybe some of the factors that are causing that would be a good place to start.
Yeah, and this is unfortunately some really kind of depressing news that we have to kind of get through. I think everybody is clear and aware that we're in the midst of a huge youth mental health crisis in the United States. This is something that has been going on for quite some time, but it definitely accelerated dramatically during the COVID pandemic. And what we're seeing are just across the board in every possible measure that we can think of, we're seeing worsening of symptoms, of diagnoses, of conditions. So we're seeing more people, more children showing up in the emergency department. In fact, twice as many people from 2011 to 2020. We're seeing higher rates of children experiencing mental health conditions like major depressive disorder. And so we're seeing about a fifth, 20% of all children and adolescents expressing that they've experienced a major depressive episode at some point in their short lives. And we also know that these numbers are particularly bad. They're bad for all kids, and they're even worse for kids that come from minoritized racial and ethnic backgrounds or from other marginalized groups, including LGBTQ children that are in families that are undocumented. There's lots of vulnerable populations within children and adolescents. And when we think about, what is going on, why are we seeing this kind of explosion? It's a number of things, and I'm a psychiatrist who studies about social determinants of mental health. What are those environmental factors that kind of lead to this to mental health problems? And so what we're seeing is it's a confluence of many factors that take place in the lives of children, including but not limited to adverse early childhood experiences that people might experience, like trauma. And what I think this epidemic is signaling to us is that we're really seeing the effects of a more traumatic environment that children are being raised and attempted to be nurtured and cared for in. And so even though if you think back historically, it's always been challenging to be a child at every point in life, we're seeing kind of a unique confluence of things like the COVID pandemic, climate change, racial trauma that children experience, more violence in people's neighborhoods and in school settings with mass shootings. We're just seeing, and generally kind of a decline of decency, which we're noticing kind of globally, as well as in this country. And all of those factors, I think, are leading to our children just experiencing more mental health issues and making it a crisis that we all really need to spend more time focused on and trying to reverse this trend that we're seeing.
Thank you for that, Ruth, that context setting. This question is for Alex. Ruth talked about environments, and one environment that kids spend a lot of time in is school. Could you talk a little bit about how the school environment both contributes to the crisis, but also could be a solution towards solving some of the issues that kids are facing?
Yeah, and I think the connecting thread here, Ruth mentioned trauma, and I think it's important to understand some really quick definitions to help us contextualize this. We talk a lot about individual trauma. One of the quick definitions of that is when things are so overwhelming, dangerous to you, that your ability to cope is compromised, right? The amount of the stress is bigger than the amount of coping that you have. And when you experience that overwhelm, you go into this self-protective mode where you're more concerned about survival than maybe on thriving, living, learning, all of those things. Those of us in trauma studies are really looking at this time as collective trauma, which is kind of the same thing on a bigger scale. The amount of danger, the amount of life-threatening things is bigger than our collective capacity to cope. And so we collectively are overwhelmed and become more focused on survival and just living, right, than doing all the things. Ruth mentioned common decency, right? If you are just overwhelmed with trying to survive, you don't have a lot left for common decency. And so what we really see is that when we have collective trauma, all the adults are struggling through that, and then they don't have the resources left to give the kids what they need, which is connection, safety, predictability, all of these things, which we're going to talk about more. So we see that play out in schools. And so a challenge is that schools are situated in society experiencing collective trauma. And so schools are not as resourced emotionally, and also they're literally not as resourced financially and everything as well right now. And so you have adults really struggling to hold the needs, not just logistically and sort of programmatically, but also teachers feeling like they have enough juice to get through the day and be present for kids who are actively in crisis, right? And for the teachers to get their mental health needs met so that they can be present. The good thing is that schools are communities, and community and relationships are really the antidote to trauma, both collective and individual. And so when schools really can prioritize, how do we take care of each other? How do we show up as a community? How do we use our resources to hold one another through the crisis? That to me is the most powerful opportunity in schools. It is way easier said than done, but there are so many things we can do to step towards that.
Thank you for that. My next question is for both of you, and it's really kind of connecting two pieces here. Often we operate in this world with a lot of misconceptions. So if you could first touch on some of the misconceptions about trauma-informed education, because I think it's a good level setting for people to dispel those misconceptions. And then I think the secondary part of that would be is, how does school design and integration with mental health help to address some of those misconceptions? So if I can ask that two-part question to both of you, and whoever wants to start.
I'll get us started on this. So, trauma-informed education has been around for quite a while at this point, and there are some really exciting, strategies and resources and frameworks around trauma-informed education. But I think a lot of times people hear this term and start to associate it with ideas like, well, you're asking teachers to become therapists. You're asking teachers to solve students' trauma. You are lowering expectations and just making everybody feel good. A lot of those assumptions come from a place of not understanding the model, but also not understanding that, in child development, making kids feel good actually is a great priority that supports learning. And so, you can debunk those through a few ways. But trauma-informed education really isn't about teachers becoming therapists. In fact, boundaries and role clarity is a huge part of trauma-informed education. Instead, trauma-informed education is really a service model, right? It's about how do we transform the environment of school, the way that school is being structured and conducted, the policy, the teaching practices, even what's being taught, with an understanding of trauma in mind. Another misconception that comes up is that trauma is this thing that kids experience out there at home in their neighborhoods, and then they kind of bring it into school like an invisible backpack, and school is the magical soft place to land. Unfortunately, that's not the reality for a huge majority of students. We know that, like I said before, schools are situated in society. So if society has racism and transphobia and ableism and bullying and lack of decency, schools do too, right? People harm each other within schools. And further, kids are often harmed by schools, by some of the practices that schools use, like seclusion and restraint, different disciplinary practices, sometimes by the curriculum. And so trauma-informed education can't just be about what are kids bringing, although it is about that, but it also has to be about how do we transform schools to not be traumatic in and of themselves. And that's really where the framework of equity-centered trauma-informed education comes from, is to really take that misconception and put it centrally to the model. And I think Ruth can pick up around those partnerships that are part of trauma-informed education.
Yeah, and I just want to reiterate that misconception. I think that so many people hold, that a school is not a place where trauma is inflicted upon students. I think that piece is really, really key, because I think in our experience and in the work that Alex does, I think there is a lot of witnessing of the school actually being the inflictor of trauma, or the perpetrator, I guess. And that's partly how Alex and I came to work together, as I was doing work as it relates to medical students and trying to understand challenges that certain students, particularly marginalized students and students from minoritized racial and ethnic backgrounds, were struggling in medical school. And I came to find that there were a lot of policies and a lot of actions in the very act of being in medical school that are actually creating more challenges and creating more trauma for students. And so even as Alex's work centers probably primarily on K through 12 education, this is actually relevant to adults across the spectrum, adult learners as well as children. And I do think that that is probably the most key misperception. And then in terms of then, what do we do and how can we kind of address that? Then I think this piece around centering equity and making sure that we are prioritizing equity in the work and in our understanding of these misconceptions, and in our understanding of how to make change so that it is effective. And what's great about that centering of equity is that if you understand then that because a school is part of a system, and because systems inflict trauma, and systems can cause oppression, and systems can create marginalization in the people that are in that system, then it's actually not that challenging to implement policies that start to reverse or start to change that. If you have an understanding of oppression, if you have an understanding of trauma, and you have an understanding of how systems harm people, then the solutions become policy-based solutions that you can pretty much implement quickly and efficiently, without a lot of financial support, without a lot of, you don't need kind of all of the things to be able to create equity-centered, trauma-informed educational policies that really start to protect and nurture students and young people, instead of creating conflict and creating stress and creating pain for them.
Thank you for that. Before I move on to my next question, Alex, I think it was Alex that made the comment about developing boundaries and role clarity. Maybe we can take a minute or two, and each of you could just comment briefly on as it comes out of the misconceptions that teachers need to be therapists, talk a little bit about how do boundaries and role clarities, support practice.
This is a favorite topic of mine. I have a paper specifically on this. Maybe we can send out with resources if anyone in an education setting wants to learn more. But essentially, for trauma-informed teachers, part of the work is understanding that adults having boundaries and clarity of their roles is so important for children's well-being. Children need to understand who you are in their life, what they should trust you with, what they should not trust you with, and they need to expect that they can rely that you're going to stick in that role. So if you're their teacher and your role is to help them learn, right, and to help them connect with classmates, all those things teachers do, but then the student comes to them and starts saying, I had this fight with my sister, and they start to go into a lot of really intense detail. If the teacher in that situation starts to try to really counsel them through it and ask about, well, how did you feel in your body when that was happening, and start to get into like real therapeutic techniques, if that teacher is not trained in that, if that teacher does not have a professional ethics code around that type of counseling, if that teacher is not expected to counsel in that way, in that relationship, it creates confusion, it can create harm, and ultimately it can just lead to a lot of mess that is not good for kids or the teachers either, right? Whereas if in that moment the teacher says, what, I hear that you're having a really hard time. Did you know that we have someone at our school who her whole job is to help kids who are having a hard time? Her name is Miss So-and-so. She's the school counselor. Would you like me to walk you there before we go to lunch, right? It's called the warm handoff, right? I'm not shutting down the kid. Instead, I'm saying, who's the best and most appropriate person for support in this moment? That clarity really helps kids stay safe, and it helps keep the work sustainable for all the adults. And so another distinction I often make is that trauma informed is the umbrella. It's about the policy, the practice, the environment. Trauma specific is a mode of support that some kids may need under that umbrella. You for sure have kids who need maybe a trauma specific therapeutic approach, but that is never going to be facilitated by the teacher. That's going to be facilitated by the counselor or a psychologist or a community support person or a cultural healer, not the teacher. That's not their job. So I could talk all day about this, but my bottom line is boundaries help keep the work safe and sustainable, and they're so important.
Really great point and a great example. Thank you. Ruth, do you want to add anything to that?
I feel like that was well said. I can't top that. So I'll move us along.
Okay. And so the paper identifies five core principles. And I thought we could take, 10 minutes or maybe a little bit more kind of unpacking those five principles. Um, and I know you also in the paper refer to the four R's. So I don't know if there's opportunity in your answers to kind of crosswalk those two. Um, and so let's have at it. And I don't know if we want to take them in any particular order, but I'll keep track to make sure we get to all five. All right. So, who'd like to start?
I'm going to also defer to Alex on this. I think Alex does a great job of framing these principles. So I'm going to let Alex frame it, and I'll just jump in with any
Perfect.
thoughts that I have.
Love it.
So I'll start with the four R's, which is a framework that comes from SAMHSA, who has a really widely recognized framework around trauma-informed care. So trauma-informed care was developed first, and then trauma-informed education developed out of that. So in trauma-informed care, those four R's from SAMHSA is recognizing the impact of trauma, uh, realizing the impact of trauma, recognizing how trauma might show up in clients, people accessing services, responding to those things that they're bringing or experiencing in the institution, and then trying to prevent re-traumatization. And so that model is really widely used and referenced, and I think is a great big umbrella. Trauma-informed education really developed about how do we apply that type of thinking specifically to schools. And then equity-centered trauma-informed education, which we talk about in this paper, is what we referenced before, of really moving that equity piece to the center and making sure that we're keeping a systemic lens. So in the paper, we talk about five pieces, and I'm going to kind of carve them out into four and one. So the first four are what I refer to in my work as the four priorities of an equity-centered trauma-informed approach. And the idea behind these is that students, teachers, anyone in the school environment needs to experience a sense of safety. And safety isn't kind of this nebulous feeling. It can be created by specific actions, policies, ways of working together that respond to priorities that folks experiencing trauma might have, or people who have not yet experienced trauma can also benefit from and build future resilience. So those 4 priorities are predictability, flexibility, connection, and empowerment. And we can dig into some specifics as we go, but the 4 of those together really recognize that trauma survivors often need predictability to feel safe and know what's going to happen. At the same time, need flexibility because trauma impacts us all differently. Healing is messy, and our bodies and minds just need, we don't need rigidity. We don't need that kind of constriction. We need the ability to sort of feel and be and exist. Then we have connection, which is all about that relationship, but not just relationship, between a teacher and a student or between the students, but also, is this school prioritizing relationship or is it prioritizing compliance? Are our policies built with people in mind or with, lines on a spreadsheet? So really that level of connection built into everything. And then finally, empowerment. Trauma survivors have agency ripped away from them by those traumatic circumstances. And so building empowerment and agency is a way for folks to feel safe and feel that they are in charge of themselves, their bodies, their lives. So those 4 kind of live together. And then the 5th sort of lives through all of it and everything, which is the idea of unconditional positive regard. Shout out Carl Rogers, who developed that originally. But bringing unconditional positive regard into education is really this idea that our stance towards students as a trauma-informed school is, I care about you, you have value, you don't have to do anything to prove it to me, and nothing will change my mind. This stance that kids are worthy, that they have things to offer, they have gifts, that our role is not to diminish them, but to lift them up, and that actually we're holding high expectations for them. If I believe that you have value, then I believe you can accomplish a lot of things. And so I'm going to hold you to that high expectations with high support. And so those 5 together are what we pulled out for this paper because I think they all have a lot of policy implications across all the different levels in education.
And just to add to Alex's really great overview there, I think that with these concepts, what we're noticing is that because of all of these competing demands, because of the many expectations that schools have, and because of the expectations on teachers, it becomes very challenging to try to practice these things in the educational setting. And I think that as schools become, especially in the United States, as schools have become more institutionalized, and people talk about more kind of the school to prison pipeline, but also the ways in which disciplinary types of interventions have become more common in schools. The way that we're seeing more schools have investments in school resource officers and police on school campuses rather than counselors. We're seeing that it's more challenging to try to address these issues. And so having kind of some clear things, I almost think that it's the default to do the opposite of these things. And so for teachers and for administration, leadership to be able to be thinking about, especially when crafting policies, okay, is this policy predictable? Is this policy flexible? Are we empowering students with this policy? And are we facilitating and supporting connection? And does this policy have, is it built with unconditional positive regard for our students or not? If we start to approach all rules and policies within schools with that perspective, we can actually make significant improvement around how students are made to feel and how they perceive their educational environment.
I really love your last point, Ruth, about how you take these 5 core principles and apply them to the development of any policy, right? Not just in the education system, but you could argue that for healthcare, and we could continue to go on there. So really do appreciate these core principles as being far-reaching. I wonder if we couldn't take another minute there and talk about where you may have seen these practices being, implemented. We always read a paper and we say the paper's great, but like, could I ever do this, right? Could I ever write a policy with these 5 principles and implement it in the Philadelphia school district? So can we maybe try to be a little bit practical here for a minute? Can anybody give an example? Either one of you give an example about that?
Yeah, I think that there are a lot of examples, and at the same time, I do just want to recognize that, people always ask me, where's a model school district doing this? Where is some policy I can kind of copy and paste into my school district? And my two things about that, one are that, I think part of this model and being equitable and culturally responsive is recognizing that each district, each school building has to do the work themselves, right? You can't pull in a model and copy and paste it onto your unique students and all of these things. And then my other piece is that there have been a couple of schools over time where I would have pointed you towards and said, oh, the model's working really well there. They did all this work. And then political backlash came for that school because of the way that things are, right? And that principal got pushed out, or the teachers doing really good work had to leave because they didn't have access to affordable health insurance, or, the one champion of the work left and they hadn't been able to push the policy through like a really, backwards thinking board. And so then things were still a mess. And so, we can talk about examples. I don't want to make people feel hopeless, but I know that we have some folks here who are funders, who are policymakers, and I just would encourage people to think about how can I really a lot of times in trauma informed environments, we have, a teacher who is teaching really beautifully, and there's sort of all these informal things going on, and it never actually makes it into the policy. And so I would encourage people to really think about, I always say, if that teacher got abducted by an alien tomorrow, is the school still trauma informed, right? How is it making it actually into the policy? All that being said, some different examples that I have seen. I have talked with teachers who were successfully able to push back on discipline policy that was, racist and ableist by nature, and really think about how do we implement greater restorative practices that really bring in that idea of empowerment, that put solving problems back into the hands of the kids, and that really help them think about how they want to be together in a community. You can see all 5 of those things embedded in a lot of restorative practices in schools. I have talked with a lot of teachers who are implementing these types of practices, in particular programs that they're designing to supplement the main work of the school. There's a teacher here in Vermont who years ago started a after-school program to try to increase equity to the wonderful outdoor recreation that we have here in Vermont. And he used a lot of these types of principles to really grow access and expand opportunity for kids to build relationships and have healthy things to do, and really improve their outcomes through skiing and mountain biking and all the things that we have here. And I have talked to a ton of teachers really using these on the ground level in their classroom, rethinking things like, how do I manage the bathroom passes? My school says you have to, really monitor these kids, and they can only go to the bathroom twice per semester, and all these, it's really wild if you look into bathroom policy. But anyway, I have teachers really rethinking and saying, that doesn't make sense. Let me think about it through this lens. And how do I, again, empower kids and what their bodies needs? How do I put responsibility with them? Thinking about their grading policies, really everything you can think of in the classroom. I see teachers working on all of that. So my great dream is that teachers would be more empowered to talk about and spread these practices, and so they actually make it into the policy long term.
And I think just to add to that, I agree completely. I'm not an educator, and so I don't work in this space. But what I will say is that, in thinking about, again, how this connects to adult learners and how this is relevant even for other educational settings. What we've been working on at UC Davis with Alex's help is really, okay, how do we examine some policies that were created a long time ago by medical schools and medical education, with the thought that this is how you build competent and skilled physicians. This is how you train them and educate them. But that actually may be contributing to some of the ways in which doctors aren't ideal in the ways that they practice and the ways that they take care of patients, right? And so we've been able to kind of start to look at certain policies that I think were created with the idea that this would lead to better doctors, and kind of analyze those policies and say, are we operating with predictability, flexibility, empowerment, connection? And are we looking at medical students with unconditional positive regard? Or maybe are we approaching medical students with kind of a harsher lens in how we're viewing them? So what I love about this work is how it applies to it really does apply to everything. I mean, we're focusing on schools, but if people just started interacting with each other with these principles, we would see a lot of improvement in. If the federal government started implementing these core principles, I think we would see a lot of improvement in the ways that things are done.
Well, I'm glad you followed up your comment about not being an educator or a teacher with what you just shared, because I was about to argue with Ruth Shim for the first time to say that you are in fact an educator, right? And that if you think about these five principles and you think about our healthcare crisis and where is there compassion and healing, so I'm glad you know self-corrected, Ruth, and acknowledge the role that you play in educating the next generation of doctors on that. And I think this point about, all of us are in an educational environment every day. We all are learners. And how do we bring these five core practices? So appreciate you embellishing on that. So I'm just keeping an eye on the time, and we want to make sure that we give a chance for people to ask questions. But I have a few more questions for us to talk about before we open that up, and I give you an opportunity for one last word. This can feel very overwhelming. I started out my career as a special educator in the middle school in 1980, and pretty quickly realized that I was not equipped to teach because we weren't talking about it as adverse childhood experiences or trauma, but working in an inner city school, kids were coming with a lot on their mind. So that caused me to, go out on a bit of a learning journey that way. So how do we practice and develop these core principles with not overwhelming teachers? Like, this is yet another thing. You mentioned, Alex, that we don't want them to be therapists. We want them to be teachers. How do schools begin to adopt these practices in a way that doesn't feel like we're adding yet another task to teachers?
Um, my gut answer is, the principal and the superintendent sit in on the training and do it first, right? Like that's part of it, right? Is that they're modeling, they're maybe changing some of the policies for the teachers, right? Like, for example, I know a lot of teachers in schools where they can't take an hour when they don't have class during the school day to go to a doctor's appointment because of some policy for teacher time off, right? You could revise that policy through this lens, right? Is that a predictable policy? Maybe. Is it flexible? Absolutely not. Is it empowering? Nope. Is it connective? Absolutely not. Right. You could shift that policy as a model to the teachers of what would, what do we want to do as a school. So, to those of you, again, who are at these leadership levels, how could you model it first? How could you show the commitment? But for folks who are in the classroom or really at any level, when I talk about the four priorities, first of all, and unconditional positive regard, I often describe these as things you are probably already doing in some way. Teachers, you've already got the agenda on the board. You're doing predictability. You already make differentiation for different learners. That's flexibility. You build relationship with your class. You've got connection. You've got unconditional positive regard to some degree, and you foster student voice. You've got empowerment and agency, right? So it's not inventing something new. Instead, what I invite teachers to do is don't think about it like a checklist, but think about it like a sound mixer. And I have this metaphor because my husband's a musician and he has these like laying all over our house. You guys are in a band, but in a sound mixer, you have little dials or what's it called? Sliders, right? Where when you're trying to get the perfect sound mix, you don't turn the bass all the way up and the treble all the way up and all the other things all the way up. Instead, you dial it in to get it just right. And so if you're having a challenge in your classroom, think about it through this lens of what do I need to turn up or down? I had a classroom where I had, this was upper elementary school. I had a little girl who was kind of always complaining that things weren't fair. She was always having a conflict with another student in the class. And that other student was kind of trying to use some of the strategies around his own behavior, like taking a break in our calm corner, taking a walk, checking in with me. And she was really struggling to just let him do that in peace. And so I sat back and I looked at these four things. I said, okay, where's the predictability? Oh, I immediately realized I wasn't making it clear to the whole class that she could use the calm corner or she could check in or she could take a walk, right? Everybody didn't know about the resources. I was looking at the flexibility and realizing that one student had flexibility, but I wasn't really being consistent. So again, how could I maybe slide that up? I looked at the connection piece and I said, you know what, the connection is pretty good on a whole class level, but maybe I need to look at how to do that more specifically with these two students who don't quite get along. And then with the empowerment, again, noticing that there were just some differences and that, maybe that one student wasn't feeling empowered to take on some ownership over herself and not be as focused on the other student. And so, I wasn't doing anything radical new. I didn't have to go learn a bunch of different stuff. I was just looking at how do I dial this in so that I'm being equitable across my whole class? How do I use these principles to problem solve? And so you can do that with a class situation like that, but you could also do that with, hey, our attendance policy is resulting in way too many referrals to the truancy board, and we know that that's really harmful for a lot of our families. How do we dial in those priorities to see if we're actually doing the right kind of work with this? What are we trying to accomplish, and is it equitable or not, right? You could do that with your curriculum and look at how often are students having chances for empowerment and connection and not just following through a scripted curriculum, right? So just encouraging people to really think about how do I dial these in appropriate to the situation I'm in.
And I would just add that in particular regarding unconditional positive regard, one of the areas that I think creates a lot of challenge for that and why centering equity is so important is I do believe that structural forms of oppression make it very difficult for people to have unconditional positive regard. And so when we talk about how important it is for teachers to be trained around bias and discrimination and for them to understand how racism and sexism and trans and anti-LGBTQ behavior and how all of these and xenophobia, how all of these issues kind of are exposed, or I guess show up again because schools are like every other setting, and how that can change how you perceive students and how you perceive their motives, how you perceive what their purpose is, and it makes it very difficult for that foundational unconditional positive regard to happen. And so in terms of like where do teachers need to start, This will sound like a broken record, but as people are pulling back on DEI initiatives and trying to do less around educating people about structural racism and structural sexism and all of these forms of oppression, I actually think teachers need more of that education and learning in order to be able to do this work effectively.
Okay, well, thank you both for that. What I want to do now is give you each like 2 minutes, 3 minutes, to just wrap up your thoughts on this topic today. And I do see that there are two questions that have been put into the Q&A piece. If other folks want to add, that's great. What we often will do on these webinars, if we don't get to answer the question live here, we'll ask Ruth and Alex to work on a response. So don't feel that a question placed in the Q&A will go unanswered. We'll do our best to give you an answer or some resources that might be helpful. So Ruth, do you want to start with your last thoughts on the topic and things we can be doing?
Yeah, I really just want to reiterate something that I already said, which is I think these are, I think the purpose of the paper and hopefully this webinar is to get people thinking about these concepts and having more awareness of the idea that equity-centered trauma-informed education is a model that can lead to it can begin to address some of the challenges that we're seeing around child well-being. And so I want to come back to that and hopefully that this work is very empowering to teachers, because these are principles that everyone can begin to implement regardless of their resources, regardless of their time, regardless of the many constraints and everything that is being asked of them. But I also want to reiterate how much it's important for this awareness to extend to funders and policymakers and people who can support bringing these types of interventions to scale, because it's, I think, a very effective way for us to put a significant dent in the mental health crisis of youth, to begin to have more resources that are prioritizing this. And that really gets back to kind of my whole focus on social determinants of mental health. One of the reasons why I'm so interested in social determinants is that that is work that is further upstream. And if you make an investment upstream, you then don't have to worry about all of those downstream challenges that we oftentimes spend too much time, resources, and energy trying to fix. And so all of this work we're putting into shoring up the child mental health workforce and trying to provide treatments and interventions, including medications to young people. We could fund these interventions at the beginning, at the place in schools where children spend the majority of their time, and we could see a lot of prevention happening, a lot of upstream prevention of these kind of downstream problems. So I consider this intervention to be, this work to be incredibly hopeful, and it just has to be appropriately resourced.
I think that oh, sorry, go ahead.
Just before you respond, I do really appreciate the point you were making that earlier we talked about community, teachers, principals, superintendents, students, and schools exist within a larger community, and that we can all work to support what's happening in schools, even if we're not directly working in a school. So I think that I appreciate that addition. So Alex, do you want to jump in here?
Yeah, I think that my sort of closing thought builds right off of Ruth's, which is that um, this is a big issue, right? Youth mental health, youth well-being is huge. If you think about one child in a classroom impacted by trauma, you have that child's peers and how they're interacting. You have the teacher, you have the family and their resources and ability to be healthy. You have the access to mental health in resources in the environment and healthcare and transportation and all the things. You have the social health of the country and the world. It's huge. It's huge. And it's very overwhelming. And so the thing I always come back to is we can't do it all and we can do something. You individually, as one person, are not going to fix all of those things, all of those social determinants, all of the individual behaviors, all of the stuff. You're not going to rescue a kid. And that's also not our goal. We're not trying to be saviors, right? We're trying to be change makers. And as a change maker, you can't take on everything. However, there is something that you are perfectly poised to do. You are positioned with your skills and your networks and your job or your community to do something that impacts one of those many layers. And so my advice to everyone is to really think about what is that one thing that I am perfectly poised to do, and then do it, right? Dig into it, make it your thing, dedicate yourself to it. And when we all are, chipping at our individual piece, and when we collaborate and connect together, we actually can make a huge difference. So we can't do it all. We can do something. Please, everyone, find your thing, and please, please do it. Our kids really need us to do it yesterday, tomorrow, urgently.
Well, I'm going to welcome Allie back in to help facilitate the Q&A piece. But before I hand it over to Allie, I do want to thank both of you. I've enjoyed last week and this week being with you. I'm smarter for it. I hope the 47 people that participated today feel the same way. And just really thank you for the efforts for kids and older learners. That out there. So, Allie, do you want to moderate or get these questions out?
Yeah. So the first question came in back towards the beginning of the conversation when Alex was sharing the story around the warm handoff. So the question is essentially, when from teacher's point of view, when there is no counselor in school and you want to take action and you feel poised to take action, what would that look like in a situation where there's no school counselor available?
My advice in that situation is to consult and collaborate and not try to make the decision on your own. Even if there's no one in your direct school that you feel like is trusted or aligned with you, I think I read in the question, is there someone at another school, someone in the community that you can connect with? Because whenever we make the choice to make the boundaries fuzzy, sometimes that can be the right thing to do, and other times it can be very harmful. And so to really see how much we can slow down, pause, get creative, right? Lots of schools don't have counselors, but are there community resources? Is there another trusted adult in the community who is better poised or with a different role to have those conversations? So not to go it alone and to really consult.
Great, thank you. So this next question is a little bit longer and I couldn't quite distill it, so I'm just going to read it. So bear with me. As a high school teacher who also does work in cultivating restorative justice practices in school for students and staff, could you talk about how systems like PBIS conflict with restorative justice and perhaps function to the detriment of those four priorities and unconditional positive regard? I think about how a token system confuses unconditional positive regard, right? So I couldn't even read it, but there, I
That
think you got what I was trying to communicate there on behalf of for Ian.
Yes, Ian, I love this question. And you got to my other, besides boundaries, this is my other passion topic. We do mention PBIS in the paper as a way to build predictability around behavioral expectations. And there are some pieces of that that are can be really helpful around that. But it's one of my academic interests to really interrogate PBIS for exactly the reasons that you said. I could go on for many years. So what I'm going to do is I put a link that we can share out in the chat or afterwards, where I actually have a whole resource roundup of different critical perspectives about PBIS. It's, there's podcasts, academic papers, some book recommendations to really dig into some of those more nuanced pieces about it. Great question. I love it.
Great. And then one from Howard Goldman, who is, we will share, is series editor. So he has had some long time to think about all of this, having edited the paper. Can you elaborate on the challenge of overcoming defensiveness as part of schools accepting that they are often the source of trauma?
I can take this one because I've been thinking about this a lot lately in the ways in which I encounter defensiveness and then how people feel about these things. And I think one of the issues are that, people's motives are good. Like, people go into teaching, people go into education to help people, to help kids, to support their mental health, to support their well-being. And so I think that a lot of times there is a gap between our intentions and our actions. And so when people are confronted with that gap, and when it is raised that perhaps you're not doing that helpful behavior that you thought you were, and perhaps maybe you're doing some harm even as your intention is good, I think people really, really struggle with that concept, especially if they've built up an identity of, okay, this is the work that I do. I take care of kids. I'm really good at working with kids, especially kids from marginalized backgrounds. And so to kind of highlight the idea that you might be driving some of the trauma, or that or that some of your policies and your intentions are unintentionally leading to that trauma, I think it will automatically develop defensiveness. I will say that I have witnessed the way that Alex talks to educators about this in a way to try to lower those defenses, and it's effective sometimes, and sometimes it's not as effective. I mean, it depends on the person, but really kind of bracing somebody for kind of sharing some difficult information, and telling that person, and helping people also to understand, like, that defensiveness is perfectly normal, but we're also here to help young people and help students, and we can move forward.
Yeah, and I would just add that, trauma-informed practices was a survivor-developed framework, and we always want to come back to the people impacted. And so we can ask students how they are impacted by things at this school, how they're harmed. You can scale those questions down for a first grader, you can scale them up for a medical student. And in my mind, if the teachers, if the administrators are willing to listen and hear those stories, those voices, then even with some defensiveness, you have a path forward. If you find that there's no willingness to even hear those stories, then I think you start to think about sometimes change isn't going to happen from the top of an institution, and there are other ways to affect change in that situation. And so just maybe rethinking the strategy.
Great, thank you. And we are at time, but we have one last question that I will pose to you both. And if people can stick around for it, wonderful. But the question is from Laura Turner. As community-based providers for mental health services for child victims of abuse, what are some effective ways we can better partner with schools to support trauma-informed care and continuity for students?
I'll let Ruth have the last word on this, but my quick thing is let the school know what you can offer and what's available. I remember a community organization in my area at one point saying, hey, we have a domestic violence hotline. Did you know that as a teacher, you can call for advice about how to support a student who's in one of those situations? Teachers had no idea that this resource was available. So partner with the school, let them know what you can offer your training expertise, and just be one of those community resources.
Yeah, and just I agree completely. And the only thing that I would add is that community work, and to be effective in kind of partnering with community, is all about showing up and being consistent. And that's the first step. So it's just a matter of breaking down our silos and kind of being in these education spaces more and showing up more consistently and saying, hey, we'd like to partner. And that can lead to a lot of really great work. And it's not particularly challenging to do that.
Great. Well, thank you both, and to Joe for moderating the session today. We do not have any more questions and answers in the chat. We do have some praise and thank you that I am echoing now. And just as a reminder for all the participants, the recording, as well as all of the links that have been chatted out, and a few other things that I will touch base with Alex and Ruth on getting some resources organized, will be sent out to you through via email to all of those that participated and registered. And we're happy to at Think Bigger Do Good take any questions or facilitate any follow-up around issues. And just want to thank you all for taking the time to be here today. We know that things are very busy and fluid in the mental health space right now, and really value everyone's time. So thank you.